about today's talk for a number of reasons. So I'm going to be introducing, but this is Dr. Jacqueline Curtis, who is the co-director of the GIS Health and Hazards Lab at Kent State University, and is going to give us, we all know, for those of us in the PRC, this is all the kind of work that we love and having the connectivity. I know a lot of you that are in the room, I think many of you share the same passion around mapping neighborhood environments and connecting it to health. Who knew that we had this incredible resource just down the road at Kent State? But we are very happy to announce, not completely approved, we'll say it that way, but Dr. Curtis and the other half, Dr. Curtis, who direct the lab, are coming to CASE, July 1st, 2019. So really exciting. So for those of you that got to meet Andrew Curtis earlier and saw that complementary side, I think this is going to be very exciting to see the complementary component of the work they do. We're very excited to not share you, I think, because we think of a lot of things we would love to talk to you about. But today she's going to talk about neighborhood mapping, but I just wanted to make sure I covered everything. So, So specializing in GIS and mixed methods. I think just for those of you who had not a chance to read the description, it's just so exciting to study how neighborhood environments shape child health. Interested in working with practitioners and community members to map new forms of data that reflects children's living experiences. And today in meeting with Jackie, I thought the part that I really loved what you said was that, we often use the objective administrative data, the things that are collected as being the evidence, and then the data that comes from the community itself, from the community's perspective and their orientation of these things is not so evidence-based. And I think that your goal and passion of making those come together is wonderful. And so we're very excited. Thank you for coming, and thanks for your time.
Thank you, Elaine. Thank you, everybody. Thanks. So before I begin, I'll say that both my husband, Andrew, and I, our goal here, and what we're going to be doing, is building a spatial epidemiology lab. But you'll see that our ideas, and I think rightly so, of how the environment shapes health, it's very broadly defined. So please keep that in mind as I'm going through this, and if you think of any questions, potential fruitful collaborations, I'm happy to discuss anything and answer any of your questions. Also, I'm not I don't like to just lecture to people and have blank faces, so feel free, if something strikes you in the moment, just get my attention and I'm happy to stop and we can talk about it. So just, I'm more casual that way. So I'm going to talk about how we can expand the evidence base, particularly in the area of understanding how neighborhood environments shape child health. To date, at least in the geospatial world, a lot of the work has focused on what we can get from the census, which can be valuable, or police data, or hospital data, etc. when we map that, and they can be valuable. However, we still have a lot of questions that exist about these relationships, these mechanisms. A lot of problems still need to be solved. Now, there are many reasons for that, but one of them, I believe, is that we haven't really done a good job expanding the evidence base to reflect the actual lived experiences of people in these places. And that's really the aim of all of my work, is how can we take GIS or geospatial techniques, GPS-enabled data collection, etc., things like this, and have them have a more meaningful reflection, a more meaningful role in understanding these relationships, which requires thinking outside of the box and coming up with some new methods and approaches, and that's what I'll talk to you about today. It also includes doing better with what we've got. So how can we take census data, crime data, medical data, and understand its context more, perhaps. Use it in some more and different varying ways. So just to start out, geospatial technologies, and especially their applications for health, have been a game changer. We can now put onto a map, for example, where we have low birth weight outcomes. That can start to guide a conversation about perhaps what's going on in these places, how can we target interventions, etc. It allows us to see, for example, where we have concentration of child injury, right? So that's this middle map. a real power of GIS and how it's used is taking different or disparate data sets and putting them together for look for relationships. So for example here, I'm going to try to hit this button here. We're looking at injury, abuse, so more interpersonal or in the family outcomes and the household outcomes, with this blue hotspot of where you have shootings reported in the environment. So moving from the household level to looking at the community level violence in a place and putting those together. We can also, with geospatial technologies, do things like get a picture of, if I could hit this button again, I'm just going to use my finger. Oh, there we go. We can get an idea through a lot of the GPS-enabled technology of where people are going, what they're linking that to the built environment, so what are they exposed to, what are they doing in those places. So GPS-enabled accelerometers, for example, have been a popular way to understand physical activity in certain built environments. This is my daughter when she was 3. She used to try out data loggers for me. How robust are they when you put them on 3-year-olds? Pretty robust, as long as the tutu strap is really strong. But this is a really valuable tool that we have. Here is an example from my work in Los Angeles where we're tracking teenagers. Where are they going? And then with accelerometers, what type of physical activity are they having in those places? So again, that linkage between environment and health behaviors and outcomes. Now, with things like Google My Maps, Google Earth, some of these open public mapping platforms, we can crowdsource data. Lots of people can tell us about what's going on in a particular place, and it's pretty easy for them to get that spatial data into a system that's mappable like a GIS. So we've gone a long way in GIS and geospatial approaches for health, but there's still a lot of questions to be answered, as I said. One of the things we've gotten really good at is where things are occurring. We're getting good at pointing to a map and saying, here, this zip code has high concentration of child injury in the city of Akron, for example. But even with a zip code, it's kind of big. Is the child injury risk and outcomes, is it equally distributed? Is this a homogeneous surface? Probably not, we know. Even with hotspots, which can be more granular, is it really the whole area? Or is it perhaps one place or a couple of places that are driving particular outcomes? So we've gotten good at where. We can get better at where, which is important. But where we have not done such a good job, or where there's still room for improvement, is why there? What is going on in these places? Hotspot maps cannot tell you, as powerful as they can be as a visualization tool, and even if it's a result of cluster detection where it is a statistically significant hotspot, you still are left with the question of why, what is going on? And the problem is that you can have multiple hotspots and they can all be driven by different processes in those places. So from an intervention perspective, linking with practice, whatever you come up with one hotspot might not be appropriate for the others. Okay, so there's a lot of room then in the geospatial world to get at the why there, to then inform intervention. So that's where we're heading today and with my work. So my background is really in environmental justice, mapping for environmental justice. I did my graduate work in geography and anthropology at Louisiana State University, and very much concerned with the Mississippi Delta and environmental and coastal problems down there. That's where my work began. But one of the things that struck me being in the field, talking to people, making observations, is that the data that I was getting for spatial statistics basically on these areas, it just didn't seem to match what was going on the ground. It didn't look to me like what it should be. And certainly when I would listen to people talk about what was going on, it did not seem that relevant to me at all. This really magnified at the end of my PhD. I finished my PhD in August of 2005, and if any of you remember, August of 2005 was Hurricane Katrina. But because I had become so frustrated in studying spatial sciences and then seeing its lack of kind of relevance for being on the ground with really important environmental justice issues, I had actually decided not to go into academia. I was in the environmental law program at Tulane because I was going to sue them. I was going to make maps and sue people based off of what I was saying exactly. I was like, no writing papers nobody's going to read. I'm going to put out lawsuits. We're going to make people pay for this. So I was in this weird place where I was in law school, but then not in law school because of Hurricane Katrina. So instead, what I was doing was taking case notes for Hurricane Katrina law legal cases through a pro bono group. At the same time, I was also working in the Emergency Operations Center, doing the mapping of where's the flooding, how deep is it, where can ambulances drive, where should you land your helicopter, etc. Where are people? So I was using all of my spatial science training, but then I was also working on being this amazing lawyer who was going to sue the bad people. That's not usually what I say, because of an audience, the not good people in the world who are hurting these folks. So again, as I was in the Emergency Operations Center and I'm making the maps and I'm giving the maps onto these important decision makers like the governor and the president of the United States, and I'm sitting here going, but I've also been on the ground with FEMA, so I could ground truth my data, and I am telling you that these neighborhood level maps of recovery or damage are completely glossing over kind of the granular nature of what's actually occurring. That became even more the case once people started moving back into the city, and I'd be out there walking around with my GPS-enabled camera at the time, of course, big camera, white girl walking through the neighborhood, the neighborhoods that didn't really have very many white people. I stuck out, and that was fine. But because it meant people came and asked me questions, and then once they heard what I was doing, they wanted to talk to me. So I got a lot of on-the-ground data, and I just thought, once again, just like in graduate school, now on the ground in real practice, where it really matters what these maps are saying, because they are guiding funds for certain types of activities, they're just not hitting the mark. Something's wrong here. We have to be able to do better. And I like this one picture we took here, because it just shows you, and this is much later in the recovery stage, but even from house to house, some people, the houses are still, or here you go up here, some houses are still boarded, some people have rebuilt, etc. Even in places where it looked like people had rebuilt, when you actually get out of the car and talk to people, a lot of times they weren't the people who lived there the first time. People moved out, and now this is rental property. It was owned by a homeowner, now it's. So there's all of these processes going on that are both spatially and temporally dynamic in these very small areas, in these neighborhoods. So I thought, well, surely we can do a better job than what we're doing with our existing data. We can collect this. Now, early on in this neighborhood audit types of studies I was doing, you were really limited to the technology. It was the dashboard or windshield survey where this address, it has these characteristics, this address has these characteristics, or like I could use my GPS-enabled camera, take a picture so I could tie it to what I was seeing, etc. That is not practical, as you can imagine, for anything of a scale larger than a few streets. It gets very time-consuming. So one of the fortuitous events we had at that time is we were at a meeting with the National Center for Geocomputation in Ireland, and they were working on GPS-enabled video for transportation purposes, so to look at where you have road signs, different road conditions, etc. And we thought, well, hey, I think we've got another application for you that may be a little bit more interesting than a bumpy road. We can show you some really fascinating results. So we started out, it was very expensive and it was very clunky, but it worked. We were able to integrate the video into a GIS and to do these more streamlined built environment studies, which changed the face of how we map recovery, even for FEMA. No longer is it acceptable to have these coarse aggregations of what's going on in a place. They can run these, and they do run these types of surveys now to map house by house what's going on, and then change over time. Because it's GPS enabled, you just follow the same track again, and you can do that. We've made further advances. More of Andrew's work has been in adding narrative to this, so it's GPS-enabled audio along with the video so that you can get the context of the place and the changes along with the video. And that's something that that we can talk about more in a different conversation. But this is really where my work started, is let's get better at where exactly things are occurring. Let's then see if we can use geospatial approaches to figure out why there, and use that to actually inform what happens in interventions. So a couple of questions then permeate through my work, which is, first is, does the scale of the map data adequately represent the scale of processes and outcomes? This is a census tract from, I think, just outside of Greenville, Mississippi, where I used to do a lot of my work in the Delta. And just look at it for a second. Now, rural areas tend to have larger census tracts in order to meet minimum population thresholds, etc. But even just look at one of these, and you can see how different, even in one census tract, you've already got farms over here, and starting moving to what you might call urban here. And even you have then some, industrial and other uses within here. Even within these neighborhoods, even within this neighborhood, right, you've got some differences as well. So we assign these homogeneous values to pretty large spaces when there's really a lot more granularity going on within. So if we move to something a bit more urban, this is Baton Rouge, Louisiana, where I've also done a lot of work. And just take a moment, look at how large some of these census tracts are. It gets better when you move into urban areas. Here you have New Orleans, where they can become smaller, where you've got higher populations. Perhaps a greater chance of homogeneity when you read off those census, demographic values, for example, but not always. I mean, even when I just go back to think about flooding, what areas experience flooding, that was a street to street. I mean, census tracts made no difference there. So then what you can expect afterward, because of that flooding or stagnant water, etc., it's at a very fine spatial scale. At the rate at which water receded was different in different places. Again, not captured by census tract. Even within these, the populations could be quite different and shifting. The other part of this is, does the scale adequately represent the scale of processes and outcomes? Is, so much of the data that we use in mapping for health is based on a residential location. How long have people been at their residential location? So what's the stability or mobility of the population? Okay, that's going to matter in terms of their exposures, right? But then also, think about your data. Are any of you at home right now? No, you're not. But all of your data is tied at your home. How often are you at home? I know for me, it's just like, it's all over the place for my work, and then school for my daughter and her activities and Girl Scouts, and home is like something that matters from probably about 8 p.m. to 6 a.m. and that's it. The rest, it's all these other parts of what I would consider to be my neighborhood. So this makes me think then that our conceptualization spatially of a neighborhood has some room for improvement, to move away from fixed locations, even though they can be valuable in some studies, and I'm not saying they're not. But when we're talking a lot about exposures to risk and access to resources, we may want to think more in terms of an activity space framework of where are people going throughout the day, mapping those out. It's more difficult. You can't hit a download button from the census and get that data. It requires more investment in field-based data collection, but I do believe that when we're working more at a neighborhood level, the scale is suitable for us to attempt to move more in that direction. So another question that permeates my work is, does the content, so we move away from the scale, does the content of the map data adequately represent meaningful variables for explaining process and outcome? So I'm giving you one example. This is one of the newly created playgrounds in the lower Ninth Ward of New Orleans, new at the time. Right after Katrina, there was a lot of investment in playgrounds. Even though nobody was in the city, it was an if you build it, they will come mentality. So lots of beautiful playgrounds were built in the city. And this is one. It's the Kellogg's eco-friendly playground in the lower Ninth Ward. It has bamboo. I mean, it's as green and sustainable. All the materials are sustainable. It's just beautiful. So if you were to look at a map of presence of playgrounds in the city of New Orleans, I'll show it in a second, it actually looked like there's a lot of accessibility to physical activity resources for kids. It would look really fantastic. And if you even went and surveyed the playgrounds themselves, they're all beautiful, gorgeous, lots of volunteers, and lots of money has gone into them. But the minute you turn your back on the playground and you look at what's across the street, depending on, these are good shots when the grass is low, but once you get to the peak of summer, you've got I mean, it's a humid subtropical environment, so you're talking like grass is high, you've got standing water, you've got mosquitoes, you've got a lot of houses that have been torn down, you have vacant houses, you have houses that are still blighted. You might think differently about the physical activity environment if you just looked at a little bit further than the playground. So when we're mapping and modeling in a GIS, the context of the data really matters. So we need to think about the content we're using and how it is used for variables, what variables it's producing. This is an example from some work I did when I first moved here with the Cleveland Urban Design Collaborative, where this is using Google Earth, as you can see, and I was going around and just surveying physical activity environments in Cleveland. And so this is the flip side. So we're in New Orleans. The playgrounds are beautiful and even eco-friendly, sustainable. And there are points on the map as a playground. In Cleveland, if you map the points on the map and you actually just go to them, go check them out in Google Street View, this is oftentimes what you'll find in some neighborhoods, which won't be a surprise to anybody here, I'm sure. It's a playground in an official database, but is it a playground in practice? I think most people would probably look at that and say no, that leaves something to be desired. So how can we use field-based data collection tools like Google Earth, like Google Street View, perhaps like spatial video that I use? How can we use talking to the community members and getting them to map their local knowledge? How can that give us more meaningful variables for our maps and our spatial models? Okay, one of my favorite examples of the census data, and I do knock on the census a bit because I think we rely on it too much, even though I do appreciate its value, so I'm just going to caveat this before those of you who use the census a lot hate me and are thinking of painful questions for me after this. Just as an example, this is an example of vacancy. Sometimes vacancy is used as a kind of proxy of neighborhood conditions, sometimes even for blight, things like that. This is a map of vacancy in the city of New Orleans in 25% category. So the yellow is 0 to 25% vacancy at the census block level. So where you see yellow, you're going to think that that neighborhood's doing okay. Okay. Now I'm going to zoom in here on the lower Ninth Ward. It's very patchy at the block level and vacancy. But if you look in the upper left corner, it kind of looks like you've got some places that are doing okay. I mean, there are a couple of other stretches as well. But I love this block because I spent a lot of time on it. Let's just look at it. When you zoom into it again, okay, wow, we've got some little patches here that look to be doing very well. If you just look under your layer, your GIS layer into Google Earth, it's the reason that the vacancy rate is so low is because the houses were removed. So, yeah. So if you only now have 3 houses and they're there, people are living in them, great. You have 100% residency, no vacancy. But if you look on the ground, it's because all their neighbors were torn off the face of the earth. So do we think that that might be important context when we're looking at the stressors people are facing in their neighborhoods? I think it probably does. But that's just one, and I know I'm picking on the census, but that's just one way where we have to be just really careful about is what's measured, what's meaningful for the questions I'm trying to answer. So where I want to go with this is I want to be able to, through my work, enhance the secondary data. I'm not saying get rid of the secondary data, but how can we enhance secondary data on the built environment? How can we then take it a step further and integrate behaviors that are occurring in these places and then be able to explain why they occur where they do, which I know is a shared goal of a lot of people in here. I approach this, I approach it from many ways. I'm going to talk about 3 things today. Direct observation of the built and social environment, I'll talk about local knowledge, and I'll talk about probing hotspots of official data. So the idea of just doing more with what we've already got, okay? Not getting rid of it, just thinking about it maybe a little differently. So as I mentioned, we use one of the tools we use is spatial video. So it's a small GPS-enabled camera, which allows us to capture whatever we see as we drive or walk or boat or bike. We've used it in all environments. What it allows us to do then is take something. So this is the Delary Street Playground in New Orleans here, and to those accessibility measures where we're saying, if you are within 800 meters, this is a classic GIS approach to accessibility to physical activity resources. If you're within 800 meters of a playground, we're going to call you having access. If you step out, if you take one step over outside that 800-meter buffer, we're going to say that, no, you fall into the no category. So I wanted to contextualize that around this one playground down here. And so what we did is just as proof of concept, what can we say about the built environment when we do a spatial video pass here? And we did a simple coding where the structure is unoccupied, was it an empty lot, was it under construction, or was it occupied? What does it look like here? So you can see that right around the playground down here that you've got, it's kind of spotty, you've got some unoccupied structures. So unoccupied really, it's usually blighted at this stage in recovery models. The bigger, you've got a lot of industrial sites here too. So it allows us to have a better picture of when we're talking about access, and when you are working on an intervention and you tell a mom, you're like, hey, look, you've got a playground right there. You get out with your kid for 30 minutes every day and go to that playground. And you look at where they live. Well, now you can kind of look at, well, what might they be walking through from a built environment perspective? What this lacks, which I'll get to in a second, is what the social environment is like, both within the playground, where I have to tell you, as beautiful as it is, I have only ever witnessed what I believe to be prostitution and drug deals. But that's just my white middle class perspective on what I thought I saw. But I've never seen children. Let me know that. I've never seen children playing there. Also, there have been a lot of stray dogs on the street because I've had to have my windows up as I drive. So when you see this type, when you're making these observations, and it's not just me, it's people who live here. They know this, These are the types of other observations we need to get in to add context. So it's one thing to improve the nuance of the built environment. It's another thing to add to the social environment. Just as an example from Cleveland, again, working with the Urban Design Collaborative, when we first got here, we were just looking at where we had land bank data, and then what did the built environment look like? Because the land bank had their photographs that they were posting. Of course, it's static. They don't have the resources to go out and check on properties like every month, how's it doing? So we just started going through some of these neighborhoods and checking what are we actually seeing in terms of blighted and demolished, which gave us a bit of a different picture than about what's going on in terms of a temporal scale of how fast things are occurring in neighborhoods. So again, the archival power of this approach, we can go back and look at change over time and code new variables. So here, just another way to give context to official data. On the left is a map of foreclosures in Mount Pleasant. Again, this was with Cleveland Urban Design Collaborative. So for a 12-year period. But what we were curious about working with them is what does that actually look like? What does that mean on the landscape? Especially because there was a playground in this area, and I was curious about how it might affect parents and kids, getting out and exercising. And so just in this one path, we drove through and we were just able to code, does it look normal? This is a judgment call. Is it boarded up? Is it a cleared lot? Or is somebody rebuilding something there? So you're able to actually see the real patchwork nature of this within a neighborhood. So one neighborhood variable, or one even street segment. I know a lot of times with our built environment audits, we look at the block face, right? Or a particular street segment. Even that can cover up the true dynamics of what's going on in a particular place, which may be a problem then when we're trying to bring that forward into models on the relationships between neighborhood health, neighborhood environment and health. Now, as I said, it's also important to include the social environment. And one of my big projects has been, for several years now, I've been working with Akron Children's Hospital on child injury prevention. Most of this has been funded through a traumatic brain injury grant. So we're really looking at active transport to school, especially through bikes, and whether or not kids are wearing helmets. So one of the first questions that we had, which was really basic, is where are kids in active transport to school in the city of Akron? Did anybody know? No. Does anybody have a database we could use? No. So what this is, my fantastic research assistant, Laura Shue, and I went out and basically drove at school drop-off and pick-out times around these schools to figure out where are the kids and what are they doing in these environments, which allows us to then basically create what we call kid highways, the routes they take to get to school and back, where you can see these concentrations or densities of them. Now, I will just say, yes, it could be viewed as creepy driving around to school with cameras in the car, but we're both moms, and we had car seats in the back, like I had car seats in the back, and my daughter would help sometime, which kind of I think probably made people not question so much. And our cameras are very small, I say that too. But yes, for those of you thinking it could be creepy, yes, it could be creepy. But when moms are doing it, it seems to lose its creepy feature. Okay, so not everybody can do this data collection. Okay, but it allows us insights then into the way the built environment is used. Okay, and insights we never had before. We also did this across 16 recreational sites over the summer to see what kids were doing, and particularly also looking for any risk behaviors that were going on, so crossing midsection on a street, things like that. So we were able to get then for the first time what they were doing in these places, so how the built environment is used. Obviously the next question is, why does it matter? Like, what's the outcome? But at least we're getting, this is the built environment, this is how it's being used, at least at these times, by this cohort of people. And it gives us more insights then to move to that answer that next question of why does it matter for their health. So just zooming in, I'll just show you, this is biking no helmet. There are a couple of the biking no helmets, walking in street, unsafe crossing, rough play, climbing a fence. So again, yes, this is a mom judgment call on some of these things, but it's our first swipe at even getting an idea of where this is, where it's occurring, and then from an injury prevention perspective for our partners in practice, then what do they need to do about it? They don't want to just give out bike helmets everywhere, which is what they were doing, because it was just a good thing to do. Like, can we find the places where they don't have them and target there? What we actually found, though, is that out of well over 1,600 observations in the summer, one observation of a bicyclist wearing a helmet, okay, and lots of helmets on the ground is actually what we found from this study. So kids are leaving home with their helmet, but for whatever reason, they get dumped when they get to the park, and then the kids are riding their bike and playing. So for our partners in practice, that's really telling. They don't need to hand out more helmets. That is fine. What we need to do is work on keeping the helmet on the head. Yes. That's the key. So this is the first time we were able to get to this through this type of geospatial approach. We also used it as a tool to evaluate interventions with International Walk to School Day. We've done quite a bit with this, which I can, if you have an interest, I can talk to you about it later. But still, we're reliant on observable outcome or observable behaviors or outcomes. We still don't have explanation about built environment behavior, why we've got these certain behaviors in certain places, which is why I like to move to my interest in local knowledge of spatial data. So, keep watch on time here. One of the problems that I have with a lot of the ways that we use maps as an evidence base and spatial data as an evidence base in interventions and planning and policy, you name it, is that we tend to think census data, crime data, patient medical data, trauma registry, I don't know, you name it, course surveys that have been done. This tends to be where we go when we make our decisions. We say, yes, I'm going to run cluster analysis on the crime data. I'm going to say, these are our hot spots. These are the areas where it's not safe for them to walk to school because of this. That may not at all be how the community feels about it. And just as a caveat, and I'm sure you probably all know it, but official data sources are sensors in themselves, with all the limitations of sensors. Police data isn't going to show up unless they're either there to observe it, or somebody calls it in, or and especially with a lot, and probably some of our most marginalized communities, especially with the immigrant communities, or those who have a lot of problems with the police. Calling the police that's not what they're going to do, and so you're going to have data gaps. They're not perfect data sets. We're certainly going to have questions about the next census, so thinking about how those data are collected. Even if I think about my work with the trauma registry for child injury, it's got to be pretty bad for you to get into the trauma registry. I mean, you're having to go to the hospital for something that happened to you. Like, what else is there that can tell us more about what's going on? What does the neighborhood know that could help us be more proactive rather than reactive, etc.? But these data that we rely on, they are authoritative. Spatial analysis can be performed on them. They produce these really convincing looking hotspot maps that people really go for. And I'm not saying they're always wrong, but they should always be questioned. What, on the other hand, tends to happen, and Elaine mentioned this is at the beginning, at the intro, is what you see on the right, and the left here, really. It's neighborhood, it's community members marking on a map, either through drawing or putting spots on, of places where they're concerned. This tends to be, if you're thinking about this official data on one hand and how it's used and analyzed in decision making, and then you have what the community know, and even when we have these points of engagement where they can provide data, they don't tend to be weighted equally in decision making. It tends to be the official data here and the community data as just an addition, a pretty map to look at. Wasn't it nice that they did community engagement? Piece. I mean, that's it. However, I will tell you that because of some advances in geospatial tools, we can take this and we can have it as a GIS layer, just like the crime data, just like the census data. And it can be analyzed in all the same ways. And I don't personally believe that it's, as long as you are doing due diligence and proper sampling and getting high enough number of participants, it has power. It has power just like the police data have power, just like the trauma registry has power. So I have no problem performing spatial analysis on it and presenting it as such. So my early work on this was in Los Angeles with the Social Identity Project with some of my colleagues at USC in planning and in criminology and psychology. And we were able to take hand-drawn maps from kids. They had Google Maps. And this was all in areas under gang injunctions, and I can get into that with you later, in Los Angeles. Anyway, basically it was male kind of teens in gang areas, and they marked on maps places where they didn't feel safe to go. And we were able to turn their markings, depending on how you want to interpret them, to points or polygons, which is like the bread and butter of a lot of GIS. So now it becomes a layer, just like a layer from an official data set. We're then able to perform spatial analysis on it. So for example, if you're familiar with this, kernel density estimation, we can run a spatial filter, we can run a LISA, so you can actually have quantitative significance here. And you can see here there's this actually one street segment in this whole neighborhood that really turned out to be problematic, and we were able to dig into what's going on, and it led to a variety of other things we could talk about. But the point is, it's the first time that really, it wasn't just this qualitative picture that people had drawn. It was folded in and analyzed as an evidence base. I've also continued to do this work. This is recently with my colleagues at Chicago Public Health on the Inglewood line health impact assessment. So relatively high crime area of Chicago, under-resourced, and it's a rails to trails conversion, which you can see here. So what you've got is the map of the crime data, property crime, violent crime, and then where they want to put the trail. And if you just looked at it, it's just a jumble of points. A lot of middle-class folks not living in this neighborhood might look at that and be like, why even put the trail there? Like, that looks really dangerous. Which is, kind of some of what was going on. It's like, how do you use this crime data to tell you where you should or shouldn't place the trail, or to guide decision-making? But it was really interesting. Underneath this, you can see we asked some participants in the neighborhood to where they're concerned about crime around the trail. And they really, they had some blotches, but really about here, and then down in here was really where they were most concerned. We also asked them about what times of day, because there was a temporal aspect to it, and why, which they were able to tell us specifically for different hotspots. We also then asked them, what do you want to do about it? So they could, through their input, they could inform interventions in those places as well. This is another example from that health impact assessment, but with pedestrian safety. So the yellow circle is the only place that showed up as a hotspot for crashes involving pedestrians or cyclists, according to the Department of Transportation data. Just that yellow. But we asked the community, where do you not feel safe crossing the road? Where do you have pedestrian safety concerns? And there's several other places that they're a problem. So if the HIA had relied only on what the Department of Transportation said in their official data, they wouldn't have addressed all these other kind of access points into the trail. So how well will it be used if people really don't feel like they can get there? So again, the power of local knowledge of spatial data. A lot of my earlier work was here with colleagues at Cuyahoga County Board of Health. We worked on the Eastside Greenway Health Impact Assessment, where we used local data on fear of crime, concerns about crime in terms of around the Greenway study area. So you can see people have really geographically specific ideas about where these places are, which is really valuable. If you're going to create an intervention that you want them to use in their neighborhood, you darn well better listen to what they say about where they won't use it, how they'll access it. And this is one way to do it. Just as one quick last example of how this is a really powerful approach is this is a Safe Routes to School HIA that I did with Columbus Public Health, where around all the schools in our area, we asked parents or guardians, where do you not feel safe with your children being engaged in active transport to school? When is it just morning, or is it morning, afternoon? Why? So sometimes it was traffic, sometimes it was fear of child predators, sometimes it was drugs. It varied, but we could map those out specifically by cause, and then also what do you want to do about it? We're mapping that as well. But this just shows you one example around this one school that it's really just this section, this point of access into the school. These back two sections are not a cause for concern, but it's very geographically specific. Okay, so the last section I want to hit on with the time we have is that despite my, what you may think is, knocking on official data, which I do a little bit, but for good reason, I also use it because I recognize it does have value. I mean, you're not going to get rid of the census. It's the best form of national, I mean, it's all over the country. It's got tons of data that you're not going to be able to collect yourself. Police data, very temporally and geographically specific and granular, and lots of good notes associated with it, usually by the police officers that can tell you a whole lot about conditions. So I'm not saying, I use these data sets too, okay? But I think we can do better. I think that some of these built-in social environment tools, local knowledge, can provide context and improve our use of them. But I also just want to wrap up on probing hotspots of the data we've already got. Okay, so what can we do? How can we do better with what we've already got? So we can look, hotspots come in all kinds of different forms. You have perhaps the types of clusters you see, and comes out a lot of traditional spatial epidemiology, so it's a statistically significant cluster of this or that. But hotspots are a more general term, meaning just a place of high density, high concentration of X, Y, or Z. Here you have, for example, this is zip code level data on Summit County, child injury. This is from Akron Children's Hospital. You have what we decided to call the Southern Crescent, which just pops up. It doesn't matter what you map for children, it just is always going to be your hotspot. Always. So hotspots can be zip codes. We don't like to use zip codes because they're pretty coarse and there can be a lot going on within them, but they can be used when they need to be. We can also then move to within zip code or within census tract. We can use point level data to see exactly within the zip code, what might be the places that are driving the hotspot. So they come in lots of different forms. And it's really important to know, what do you need to answer your question, to inform your intervention? You don't always need the highest level spatial stats to answer your question. So it's important to kind of think about, what do you need when you start to decide to use spatial data and to use hotspot methods. So some questions I like to ask now about official data, hotspot data, is the hotspot really there? And then, how stable is it? And the how stable is it, is it really there, are both questions that we tend to just gloss over. We tend to accept the output from our spatial analysis and say, well, the data says it's there, it's there. There can be all kinds of reasons why it might not be exactly there, and it may not be stable. And by stable, I mean that the outcomes, it may not be year to year, it may just be seasonal. There can be that type of temporal variability. It can be a daily variability. So you have to be really careful in assigning stability to hotspots without really testing out a whole bunch of different scenarios to see if that is actually the case. What is there with it on the ground? So we can now, through the beauty of Google Earth, you can take anything in a GIS and you can put it in a Google Earth, and you can make it semi-transparent, and you can zoom down in it, and you can drive your hotspot. I mean, that is such a simple thing to do to ground truth what you're doing, and can give you so much insight into validating the hotspot and providing some additional context for why it might be there and what's there with it. And then finally, I like to ask, and this is a real power of GIS, is what is there with it in terms of outcomes from other data? As I mentioned, we've got the old Southern Crescent for Akron. If I was, and I've been in meetings with Summit County Public Health where we're looking at, you name it, just across the board, a whole range of child health outcomes, and almost all the time, your concentrations are down here. You'll have an occasional concentration up here in the North Hill, but mostly down here. So when it comes to research and intervention, we tend to all work in our silos, right? And yet the places that we're working in tend to be the same. Oftentimes they are the same places. So when we take, and this is the real power of the maps and the hotspots, is if that we look at outcomes from other data, maybe we don't just need to be focusing on physical activity in this area. Okay, so maybe there's an obesity problem, we're looking at food and physical activity. What else? Can we look at community stressors like crime data? Can we look at some of the interpersonal stressors that we may be able to map out from police data? When you start to stack them all up, it means that, or if you want to talk about like smoking cessation, for example, perhaps you want to look at what else is going on there, which a map allows you to do before you move forward, because if you just address one variable, one outcome, you may not be successful, number one, and I would question whether the success could be sustainable in the long term if you have all of these other types of exposures going on in this place. So perhaps we can use our hotspots better by reaching out to our colleagues and putting all of our hotspots together to see what's going on in these particular places. That just zipped past me. It's also important to think about, we get these hotspots, but there can be hotspots within the hotspots. There can be places within the hotspots. There are microgeographies. There are different causal mechanisms. I've just, kind of mentioned some of these. So it's upon us, as me as a spatial scientist and as I communicate with my colleagues and partners in practice, to actually look at these. And the hotspot map is your first port of call. It is not your last. It is what drives then the additional questions and interventions. So, and there's so many ways now to probe your hotspots. So, for example, we've got in the hash mark, it's high child injury zip codes. We've got hotspots then of police data on shootings, domestic fights with weapons, injuries, etc. So, what we've started doing is working with my colleagues in the hospital and the police department and public health is we grab all of our data and we throw it onto a map together. And then we find, okay, where are our hotspots? This is where you can go into these places, for example. And what I like to do is I walk around the Akron Police Department with a big map of hotspots, and they are kind enough to let me just lay it down on the floor, and they tell me what's going on in those places and why, and I just write the notes. Also, this is where we do geonarratives, where people go into the field with us and they drive the neighborhood and talk to us about what's going on. I have colleagues in healthcare and people who, especially parents in the communities, who will also sit down and either look at a hotspot map or map something for me, etc. And now we can start to really build an evidence base of what is going on and where and what to do about it in these places. So just an example of child pedestrian injury, there's one area in Akron where it just, no matter what age group you're looking at, these are hotspots for different age groups, it's just the same. So if I put the points on here, you'd see points all over the place. However, what we have is we have, what you call frequent flyers or repeat offenders or whatever, but we have, within driving a lot of these hotspots, we have very particular places that are just, it's going to be that place every time. So when you're directing resources, do you really need to be looking at the entire hotspot, or do you really just need to be looking at the hotspot within that's actually driving it? So here, for example, what I've done with this map is, again, walked it around the police officers who work in this area, and they were like, not only were they able to tell me about the hotspot, but they said, yeah, it's really these places, and this, even though it shows up as just having a few repeats, it's actually probably the riskiest place in this entire hotspot, perhaps even the riskiest place in the entire area, because it's across from the high school. When the kids get out of school, they have open enrollment, so lots of kids get bused. So what happens is the kids walk across this really busy road to a McDonald's right after school, and they have to wait for the bus, and it's within that time period. It's not even all the time. It is this place at this particular time on a regular basis for these reasons that you have your hotspot. So it's not this, we must mobilize all these resources to try to address this. Like, we should probably do something with the way that kids are able to cross the street at this time of day right after school to get to the McDonald's and then catch their bus home. That's it. We could probably erase the hotspot then after we do that. No massive use of resources. So this is where probing the hotspots we have can be really, really important and valuable. So also here, for example, we have hotspots of family violence, which I've been working on with Akron. And if you go into this one hotspot, there are a number of places that have family violence in this area that are recorded in the police. That's true. But there is one address with 53 over the time period, different offenses in the database. This one, somebody needs to go to this address and knock on the door, and we need to figure out, is it the same, because this is also a highly mobile population. Is it something about, is the family there in crisis? I mean, really? This is a lot. It feels like we should probably not have this many offenses for one family. That just seems unconscionable to me. And the children who are in this house. Or, I don't know, is it the types of families that are moving into this place? What is it? You know, what is going on? But really, if you could go in and intervene with what I think is one family having a lot of crisis, you're really going to be able to kind of lessen that hotspot. So it doesn't have to be complicated, massive pulling together of resources. It can just be going in and figuring out where's that one place, and let's talk to people there. So again, a lot of value in putting these different variables, different insights into place. And I'll end with this one. I think I'm just about in time. This is, again, one of the studies I did on Akron with active transport to school, and I think it summarizes how I feel and my perspective on this in general. So the red is high incidence of child injury zip codes. The green dot in the middle, the flag, the school symbol is a school. And then we're in the 2-mile buffer because, at least in Akron, within 2 miles, kids are not bused. They're looking for some other way to get to school. So with my colleagues, we're looking at the context of active school transport, because this is also an area where we have a lot of poor health outcomes, not a lot of physical activity, stress, obesity, etc. So if we're looking at this area and we're thinking that parents need to be like engaging their children, let's get more kids out biking, let's get them walking to school, like that would really help. This is where if you just talk to the hospital, they'll tell you, well, we get a whole lot of injuries here for a whole lot of reasons, so there's something up here. But more importantly, I think, is that if you look at the police data, this is hotspots for child pedestrian collisions over a multi-year period. So here, along the route to school, as you can see. But then also, we have these hotspots for shots fired, which are indicators of levels of community violence. Now, it's important to note, the shots fired may not be when the kids are walking to school. They could occur at different times. But it might be an indicator of what's going on in the community. So when you're going to tell these parents and these kids, get out there and get on your bike and walk to school, what are they walking through? And is it actually better for their health or worse for their health? Might it improve their physical activity but put their life at risk? Just as a quick anecdotal side note, one of the things we found around one school in Akron is there was another area where kids were getting hit crossing like mid-segment. And there were crosswalks. There was my colleagues, they went and they checked it out. It was like, built environments, fine. Why are they doing this? And so they went and they just hung out to just see what was going on and listen to the kids talk. Turns out there was a house on the other side that was known where there were drug deals. Their parents had told them to stay away from that house. It was smart parental guidance, stay away. So they were going around in the street, and in the process, kids were getting hit. Now that doesn't even touch on the near misses, which I think you could also pick up with mapping their local knowledge, is where you have these near miss locations for people getting hit walking to and from school. But good parental guidance leading to child injury because of what was going on in the social environment, despite what the built environment may tell you. So that's my favorite, it's horrible, but favorite kind of antidote of why we really need to get on the ground and expand our evidence base when we're mapping and in spatial analysis, so that we have not necessarily significant models and outcomes, but meaningful They can also be significant, but they really need to be meaningful for the community and their outcomes and their health. So just a few things. I'm looking at these kind of indicators, the canaries in the coal mine. What can we capture about children and their behaviors and environments before they end up in a police, hospital, or death certificate sort of database? Like, surely we can pick them up before they pick up the risk before they end up in these as these points on a map. We do not want those points on a map. I'm really interested in capturing how can we get at the mobility of children to truly understand what is their exposure to risk and access to resources, as well as an indicator of stressors in their lives. So one of the ways I've started trying to look at that is with schools. How often are the kids leaving school within a year through public schools as a way to look at that. And tied to that is I'm working on homelessness and health service delivery in Southern California, but I think that could certainly be applied here in Cleveland as well. Opioid work here in Ohio, because you can't not work on it. To me, I cannot work on it as it's going on all around me, especially in rural Ohio. And then finally, I'm doing some work with climatologists and other colleagues on climate change and health, but not disease, because yes, there is that, but there are also, I think, linkages between climate change, extreme weather, and then injuries that are resulting to that, which have application, I think, very much here in Cleveland as well, with extreme cold and extreme heat, because we're not prepared for the heat. We don't have air conditioning in our buildings, so it has implications there too. Okay, I will wrap up with all the awesome people who have funded me and helped me, and I'll just take questions if we have any.
Do you have any questions?
Yes.
Thank you for your talk. I'm struck by the extent to which your emphasis is on looking for the why, and I love that. But there was one slide that you showed that points out that there are different sorts of analyses that can be done, and one is within a neighborhood and one is between neighborhoods. And the less granular data is useful for between neighborhood evaluations. You showed a slide of foreclosures in the Mount Pleasant neighborhood, and right across the rabbit tracks, I live in Shaker Heights, and the difference between foreclosures in Shaker Heights and Mount Pleasant is every bit as dramatic as what happens within Mount Pleasant. And I just wanted to point out that between neighborhood analysis is often what drives the need to look at the within neighborhood
Absolutely,
analysis.
absolutely. And I would actually, to that point, I think that is another place where the official data is really, that's where census data can be incredibly valuable, because it can start to draw your eye to the areas and identify areas where you're seeing these, especially when there's stark differences. When you see those where it's, like on a map at least, it looks like you stand on this side of the census tract or this side of the zip code and it's one thing, and I just moved slightly to my right and it's something else. Well, we know that on the ground it's not really like that, but it's indicative of a gradient that is occurring. There's something changing there.
Right.
Why is it and what's going on? And yes, that's where official data is really
Even
important.
the life expectancy data, for example, in that we've done analysis across those rabbit tracks in a sense. I used to be the director of the Shaker Heights Health Department, and there's an 8-year difference in life expectancy between census tracts on one side of the rabbit track and on the other side of the rabbit track.
Yeah,
So,
absolutely. I mean, that is an important area of research. I think because that has gotten, at least on the spatial side, it's gotten so much of the attention because of the availability of census data and its ease of use of spatial analysis. That gets a lot. I don't think it's completely done well. I absolutely agree. But I think then it's the within where we just have massive gaps as well. Yeah. So yes. Yes, ma'am.
You talked about the importance of looking into the when, and that is something that needs to be looked into. Not having done any analysis really, because I'm wondering, is the police data given in such a way that it can be broken down, or does it come out of the police departments in a way that time can't be broken down without going back and having to put it in a different way?
That's a good question. It depends on your police department. I will say that Akron, you may not think it, but Akron has one of the best spatial data sources on crime. The geocoding is accurate. It's all been every address or locations have been pre-geocoded. They have GPS enabled. So it's updated in the field as officers are out there up into a database. So it's just as things are occurring, you're able to see it. They have an extensive number of variables associated with it. And my favorite, I didn't show it because I didn't think I'd have time, but they have a column called narrative. So they have when the event occurred, when it was reported, which for a lot of events are very close. If you look at things like sexual assaults, big gap. So I mean, you have to be very careful with the sexual assault data. But they have a column called narrative. Now, it's not a narrative as you or I as a researcher would think of it. It's really a notes field. That notes field, what those officers observe and then write in there, that's one of my canaries in the coal mine, is how can we do a content analysis and then map the content analysis of what they're seeing in these places, because they're oftentimes being called out to something that perhaps has nothing to do with children, but then children are there at the home. So it gets a child endangerment code, and then you get notes about the conditions, the living conditions of the children, or what the children were like, etc. Which tells, and those kids, if you had access to the identifiable data, they may never have shown up in the injury database, the trauma registry. They may never have shown up, in any official data source. But I bet you they will soon. If you look at what's going on in their living conditions. Yeah, exactly. Yeah.
One of the most striking things that I've seen in our geospatial analysis relates to the extreme residential segregation, and I'm wondering how that factors into your work and analyses.
Yes, that is one place where I'd say that the census is actually pretty good, because they try to make populations as similar as possible, especially at the smaller units. Tracks get really hard. Blocks, though, if you can get, that tends to be more representative of the actual segregation. I think it provides a lot of complication when you're looking at health outcomes, for example, at a zip code or census tract level, when you know that there's a lot of segregation. You see it in Cleveland, you see it in New Orleans. I mean, there can actually be different processes at work for different populations, race being a big driver of that within one place. So very different experiences for one set versus another set in the same built environment even, or perspectives of that, what that means to them. So it's a major complicating factor, but it's probably one of the most important to understand, because the experience, again, the lived experience, you map the lived experience, and if you can have a large enough set of participants where you can break out the cohorts on the basis of race, I think you'd start to be able to speak to how that actually plays out in reality.
A communication question. So I recently created maps for the medical examiner's office on all the opioid deaths. And when I created the maps, they wanted it by county wards for policy reasons.
Right.
And to me, that just seems like it's just not that useful. I mean,
Right.
For policy reasons, it makes sense, but how do you communicate to people that are even in this field, in public health, that we need to be more granular, we need to be thinking about the data in different ways, and not just from those spaces where we can make policy changes?
So, excellent question on a really important subject, something I've been actually struggling with lately. So when you made your maps, was it the death location was the residence, or the death where the overdose occurred?
Both. So I did injury location and home location.
Okay, so
So home location and then injury location.
Okay.
Yeah.
And how often were those in different wards?
Yeah, they just wanted.
So you did one map of each?
Yeah, one map of each.
Oh, okay, got it.
Yeah.
How similar were the maps?
Somewhat similar. There was some difference around, I would say injury location was probably more specific. It was more clustered, and then home location was more.
I would expect that.
Yeah.
I would expect that, yeah. So we know from the geospatial side of research on opioid overdoses that people tend to go to the same sorts of places to take an overdose. Parking lots, bathrooms at fast foods, places where they could be found if they need to be found, and yet they still have some privacy. So the McDonald's bathroom is a popular place. It will show up as a hot spot. of overdoses. The people, though, the communities they come from, which probably might be what the social, economic, et cetera, cultural influences might be driving that behavior, can come from all over the place. I'll take one of the things that we found in Kent and Portage County is that a lot of people, they'll go to Akron to get their drugs. So they live in Portage County. They'll go to Akron to get their drugs. But then they come in and they'll overdose in Brimfield, which is the first exit after you get into Portage County after Akron. So it's just a convenience. It's a geography of convenience. But yet those data, it makes Brimfield look like Brimfield has a serious drug problem. It's this tiny speck on a map. But it's because of interstate connectivity. But these people, if you're really trying to intervene, so you can intervene with like Narcan. Yes, you need to know the hotspots of overdoses for Narcan allocation, right? But in terms of if you're trying to do like from the ground up, like grassroots type of getting at the core reasons behind this, that's out where they live, and that this can be really different places.
Right. And I mean, there is a huge cluster in like just like Lakewood area and on the west side. But when you look at it in terms of wards, like Ward 11 is massive, and it goes from Euclid all the way down to close to Parma. And some of that data from the west side is then causing that ward to just look like it's almost equivalent to the west side.
Yeah.
So it's just, I just don't know how to best communicate to even researchers as well that like that these issues exist. So I don't know if you.
I'll tell you something really basic that I do in maps where I think my maps are complicated. Like there's more going on. Sometimes I'll actually say it's sometimes best not to map it because it leads to a false impression of what's going on.
Yeah.
Sometimes it's better to just give them tables and write a paragraph because people read a lot into a map, whether they know to be critical of it or not. We just can't help ourselves. It's a very powerful picture. So sometimes just don't map it. If you think it's going to lead to a miscommunication, don't map it. The second thing I would say is sometimes what I'll do is I will write, like I'll put text in there about just bullet points, nothing to confuse people. A few full of bullet points so that they can't help but see that with the map. So they're going to be immediately triggered. And those are not like high level, brilliant things to do. But I found them to be effective, especially if you can kind of overlay the text into the map a bit, which is bad cartographic practice, and you should never want to do that. But when it's really important for something like this, yes, do it.
If I can follow up on Matt's maps, one other area that we've focused in on is suicide, and it looks at the granularity issue that you've talked about. Again, using the medical examiner's database, we've cleaned the database to be able to look at suicide modalities and then map the different suicide modalities. And one of the most impressive things that we found with suicide modalities around jumping is that we really identified 3 areas in Cuyahoga County where people die from suicide by jumping. That's the injury location, and in our original maps it made it look like there was, Rocky River was a big place for suicide because Rocky River Reservation is there and suicide by jumping occurs there. So, there are others are bridges. And that gives us an opportunity to intervene in those locations and to do some further analysis once we've identified those 3 injury locations for jumping. So the other thing, as Matthew would tell you as well, is that the opioid data and the suicide data are nearly identical in terms of where those things are happening, which is really interesting. And it's not just because opioids are being used for suicide, because relatively speaking, there aren't that many opioid suicides. They're not categorized as suicides, categorized as overdoses.
That's the real value in pulling like things that you might think are different or just not at all related, and just try it out. Just put it in the map together, and just start to see if you start some things that start to emerge. Yeah.
This brings it back more to maybe the methodology in applying this in research projects. Is that it's striking me now what you're saying is that we often use much of this methodology is based on these national approaches. and Eric and I talk a lot about this, where there's just lots of, when you look at something nationally or large scale, you have lots of diversity. And so the distinctions, you see distinctions, and then when we use that same methodology in a local space, we don't see it having an impact. You're like, well, how can this not have an impact? But then there's less variability. So curious, right? Just on this too. So is this method the method in which to dive deeper to create that variability? Does it, in fact? Like, does it work that way? As if you dive deeper, then you then see the more granularity, and you see, and then does that predict in the same, not the same level, but does it predict as it would on a larger scale?
Could be. I mean, there's so little known about getting geographic context. I mean, that's where all this is kind of coming from. But that is the suspicion that this is the level, the types of data we need to be getting at to then have the explanation.
And then how do you apply it in a bigger way?
Well, and then, are there, do we see similarities? Are there typologies in geographic context? But we've never really looked at context. The technology hasn't been there, and we've been so divided in terms of qualitative and quantitative, and that's true in the social sciences too, that there hasn't been the kind of the theoretical will to do it, and now there is. So I think these sorts of things will start to be answered. But if I could just say one more thing that I thought about with doing your maps. If you feel like you're mapping something at a scale that's not meaningful, and you're doing it because they told you that's the scale, put in the map that you think is meaningful and put it on top. They'll just get mad at you, and you just ask for forgiveness.
The issue, though, is they're kind of doing their own things. I just create accounts for them, so I don't know who's doing the mapping for them, but they're making all their maps by wards.
You can this is my environmental justice, like counter mapping me coming in. Do you think it's not doing service to the people? Then you just do it anyway and just say, I just thought this would be useful.
No, I know. Yeah, it's as much a political as a scientific issue.
I just did this with acronym of youth violence, and the way they wanted to approach youth violence, I did not agree with. And so I flooded them with many maps that never made it into the report. But my conscience is clean.
Very well. We all have a little bit of that fighting nature. So, any